A very warm welcome to all of you for joining us today from all corners of the world. Welcome back to Global Youth Mobilization's virtual celebration events and to our side event, the Youth-Led Solutions Showcase. Follow us and share your comments on our Twitter, Facebook, or Instagram using the handle @GYMobilization and using hashtag #UnstoppableTogether or hashtag YouthMobilize. My name is Dominic Novakovsky, and I am your host for this event. Hailing from the United States of America, I'm a freshman at the University of Washington in St. Louis, studying the classics, art history, and biology, and I've had the pleasure of serving as a youth panelist for GYM. As such, I am honored to be moderating this event today. I do sincerely hope you enjoyed the main virtual event and left it feeling as we did, with a strengthened belief that young people are indeed unstoppable together. During the main event, you heard from projects delivering youth-led solutions across our 4 thematic areas. In this side event, we'll be taking a deep dive into one of these themes, mental and physical health. We will hear from 3 innovative and inspiring projects from across GYM's 3 core programs, national projects, local solutions, and the Accelerator program. We have with us today Project T, a local solutions project, mental health support for healthcare workers, an Accelerator program project, and COCO, Come Back from COVID-19, a national project under the YMCA. We are also incredibly lucky and honored to have a leading expert on mental and physical health with us today, who will share valuable reflections with the projects and take questions from the young people leading them. It gives me great pleasure to introduce Shakira Chunara, a multi-award-winning public health practitioner appointed to both UN Women and the World Health Organization. She is a startup entrepreneur and founder of a development consultancy firm and is a proud recipient of the 2017 Woman of the Year in Health in South Africa. Shakira, thank you for joining us today. And without further ado, let us begin the event. I bring you our first project showcase, Project T. Michael, I would like to invite you to introduce yourself, lead us into your project showcase, and then pose a question you have for Shakira.
Okay, my name is Michael, and I'm 29 years old. I'm from Nigeria. I'm the founder of Let's Speak for Humanity Initiative and the project lead for Project T. Yeah. As most communities in the developing world, especially the group of internally displaced people group, were faced with lack of basic amenities such as toilet, being exacerbated by the COVID-19 pandemic. Our project aims to promote health in these impacted communities. We designed and built the first mobile toilet in Nigeria using recycled plastic materials. This is to help fight open defecation and also plastic waste pollution, helping to achieve the United Nations local development goals of leaving no one behind. In northern Nigeria, Nigeria's Kagral village of about 4,000 internally displaced people, this mobile toilet is already being used. And what's more, we were able to teach about the COVID-19 pandemic, environmental cleanliness, and how to build back better through resilient effort to about 2,500 predominantly student, adolescent, and vulnerable communities. Furthermore, to maintain our work and our program, we'll be able to teach small number of young people to carry out this advocacy work for environmental sanitation and health environment to assist to combat open defecation in these communities. This project challenges our abilities as youth as a significant dividend of today's global population and as key agent of socio-economic political movers of any society that will play a critical role in our nation's readiness, particularly as it relates to influencing the environment around us to endanger economic and attitudinal change. Finally, I believe the bridge that will connect Africa to the rest of the world in this contemporary time can only be built by people equipped with global mindset in solving emerging problems. So we look forward to more support and funding. We are greatly, we are very grateful for the Big Six and the global youth mobilization for making our world more sustainable, inclusive for everyone. Thank you. I appreciate the opportunity given me to ask, and I would like to know how and where can we access opportunity that will allow us to make more impact in our community, opportunities including training, funding, etc., with regards to mental and physical health. Thank you.
Thank you so much for the question, Michael. And firstly, I want to say that I'm super excited to be checking in to the Global Youth Mobilization Celebration. I was actually part of the launch in 2020, if I'm not mistaken, during the pandemic. And it's really exciting to see how this has flourished. And also to be able to give back through being a mentor. Michael and team, I hadn't heard of your project until today. I mean, I've been through the site, but it's so nice to get the in-depth sort of insights into what you and the team are doing. So massive congratulations. I think there's 2 or 3 things which come to mind first before I jump into a response to you, of course. And the one is human dignity. What this project is doing is essentially making sure that people on the African continent have human dignity and elsewhere in the world. It's such a basic need that I think as we go through our daily life, we tend to forget about it in the development space. And it's something that you and the team are also showing you're able to sort of find solutions around. That's my first thought. And then I also thought about it's not just an environmental issue, but it's so closely related to being a health issue. And besides individual health, the impact on community health, population health, and the health of the entire country per se. So in terms of curbing the spread of disease, etc., that is so critical. And finally, working within the gender space as well. I think we tend to forget about, having good latrine facilities or sanitation facilities and what it means for gender equality. And so in many settings that we work in as UN Women, for example, we see high levels of gender-based violence where there aren't safe toilet facilities. And so you're also filling that gap from a gender perspective. We also find, for example, I don't know if it's factored into your project in any way, but to also think about the safety of women and girls within these public toilets or these toilets which are being built. So that's my initial sort of response, and I wanted to share it before jumping in. Thank you for the amazing question. And I don't think I have all the answers. So this is a dialogue, and hopefully those listening in will also share as well in different ways. And, when we're thinking about community projects, I think it's so important for us to think of 2 things. And one is sustainability, and the other is ownership. And so working with communities, it's so important that, and I'm sure you're already doing it, but it's so important to foster the partnerships. It's so important that the community themselves, for example, we see some universal health coverage schemes where communities themselves contribute money into a pot for these, for these sorts of initiatives. And what this means is sustainability. So we're not looking for donor funding. We're also not, for example, having once-off projects. But that being said, I do understand that the communities we work in are so rural, they're so impoverished. And so looking for opportunities, I would say, is 1, driving advocacy within local governments and national governments, because these are services which our states are supposed to be providing. 2, it's getting that proposal really well thought out, the impact you're really showing through this video and some of your work. Communicating impact could lead to backer buddies and crowdfunding, for example, to lead to more opportunities. And then finally, also saying that, we do see organizations open up for funding. So like Global Youth Mobilization, etc., getting your proposal in. But it's also often useful, and I've seen this in the civil society space, to turn it around. So do the work, show the impact like you have been doing, and then approach organizations. And then finally saying, these partnerships are so key. It's not just about funding. I think it's about establishing the partnerships. I think it's about creating scale. So what you're doing in 1 or 2 small districts or provinces, how do you expand and scale up to other parts of not just Nigeria, but across the African continent? even in South Africa, which is my home country, it's an upper middle income country, but even we have this problem in areas such as the Western Cape / Cape Town. So again, really, really excited. And I think that the offspin and the impact of health, gender, environment is absolutely exciting to see.
Thank you, Shakira, for your insights. I completely resonate with the fact that it's important to kind of foster your partnerships and also involve yourself in the community, kind of lobbying for your projects and trying to get funding from a higher level. Next up, we have Lom. Lom, please introduce yourself, showcase your project achievements, and then pose your question to Shakira.
Hi, my name is Dr. Lom Brian Bidnen, and I'm a medical doctor from Cameroon. I am 27 years old and the team lead of the project Mental Health Support for Healthcare Workers in Cameroon. And the impact of COVID-19 on the mental health of individuals was unprecedented, and health professionals were at high risk. In Africa, the condition was even worse. Health personnel were at the forefront of the fight against the pandemic at all levels. Our aim was to provide psychosocial support to healthcare workers by carrying out 3 major activities, including capacity building, screening for common mental health conditions, free psychologist consultations, and advocacy meetings with health administrators. Our team was made up of 3 young individuals, and we recruited the services of 2 clinical psychologists. As achievements in the local solutions, we reached out to 75 healthcare personnel with capacity building on burnout, anxiety, and depression. And in the acceleration program, we reached out to 100 healthcare personnel with capacity building, online support group formations, and free consultations for health personnel. As results, at the end of our project, we found out that 65% of our participants had some form of burnout and 21% had depression. We provided 82 free consultations for 82 healthcare personnel, and we were able to create 2 peer-led support groups and met 5 health administrators. We learned at the end of our project that mental health is only a taboo when there is no one to listen, and that the perception of job satisfaction is more linked to the mental health rather than to the remuneration. And as problems faced, we have had problems in creating sustainable partnerships and in the continuity of our project after the. Thank you. Thank you for the opportunity to ask this question to Dr. Shakira. After recording the pitfalls and limitations in the resilience of health workers during the COVID-19 pandemic, what have the World Health Organization and other international bodies done? And if not, what can be done to salvage this problem?
Yeah, thanks for the question, Lom. And it's great to check in with you. So for those listening in, Lom, Ruben, and others on the team, I've been serving as their mentor over the period of their project, and such an exciting project as well. I think that's the key word for this morning is really exciting. Lom, I want to start off saying to you and the team, thank you for what you've done during the pandemic. It's all the more powerful because you're health workers yourself. So you know what you're going through. You're designing projects which are essentially so linked to the beneficiaries you're targeting as well. And so I think that's really, really exciting. That's the first thought. The second is that you're young healthcare professionals and you're filling this gap within the system. So turning a little bit to the World Health Organization, and one of several hats that I wear is to sit in the Department of Health workforce. And so the way the World Health Organization sort of operates or implements is not really immediately or implementing themselves, but rather that we have strong partnerships with regional level organizations or also country level organizations, specifically member states. And what we saw during the COVID-19 pandemic is, and your presentation is exactly spot on, so is your video, around the increased levels of burnout, increased levels of stress and anxiety among healthcare workers. Among female healthcare workers, approximately 67% of the health workforce is female. they had a large care burden, unpaid labor, taking care of children, their homes, etc. So, levels of stress we don't have the exact statistics, but probably much higher among female healthcare workers. One overlooked issue is that of stigma and discrimination, especially early on in the pandemic, where we saw that many health workers were stigmatized. So were their families, and that also led to stress and anxiety. So all of this already existed in the healthcare system prior to the pandemic, and it was exacerbated. What we saw at the World Health Organization was so exciting. On the Working for Health program, for example, we were able to have flexible funding. So we had funding already dedicated for health workforce programs, but during the pandemic, we were able to quickly reprogram and have an emergency response, but we built on existing mechanisms which were already being used. And the Working for Health program works or is primarily implements in 23 plus countries across the world. And it builds on approaches such as occupational health and safety. It builds on training around occupational health and safety, mental health, psychosocial stress, also helping governments with policies and programs in emergency responses. And during the pandemic, we retailored and reprogrammed our funding to immediately fill this gap on occupational health and safety, physical and mental health, etc., among healthcare workers in settings such as the West Bank and Gaza, for example, in many settings on the African continent. And so what we saw, at least during the pandemic, was a very quick shift in trying to fill this gap. That being said, resources were quite tight, and I think that there's a need for massive levels of funding focusing on this, and that's where, for example, LOM and team were able to fill this gap, LOM. So I think that's really exciting. Going forward, it's about thinking about, how do we bridge the gap between young people, these sorts of projects, and massive international organizations, governments, and regional bodies to see how we can partner and think a little bit more about that. And then finally, just jumping ahead and thinking about the online and the digital space as well. We ourselves didn't directly run any online programs, but I do know, for example, the Africa Centers for Disease Control had large training and online support programs. So that was something to leverage in the pandemic as well, and to think about when we're designing mental health interventions. And then also thinking about how do we, as healthcare workers, we work in the healthcare system itself, right? But do we even have the time to access these healthcare services, such as mental health services? Do these mental health services even exist in our countries? Do they exist in our facilities? And so I think these are all the questions that we need to grapple with. But I'll end off saying that 1, flexible funding, 2, a quick response was absolutely incredible from the World Health Organization side. But then I think the challenges that lie ahead, there's quite a number of them for us to consider. And it's about us working together to try and address this gap.
It's actually such a strong point. The pandemic allowed for an opportunity to kind of improve and create different mental health protocols. And I'm very happy to see what the changes are coming, and it's quite exciting. Now it's time for Yuragu to take the stage, walk us through the project showcase, and hear Shakira's pearls of wisdom on the project.
Hey. Hello everyone, my name is Oronga from YMCA Mongolia. I'm 22 years old, and today with myself, one of the leading member of COCO project, Tonga, we are going to present our COCO project now.
So you might ask, what was the push-up for making this project? So it was absolutely big impact of lockdown in Mongolia. During lockdown times, 1 out of 4 to 5 people had been in a strict quarantine since lockdown started. So it includes anxiety disorder, depression, etc., etc. So what we did, you see in the picture, we set up a really beautiful room, which is called COCO. We created a warm and welcoming atmosphere there, and we organized some sport events such as volleyball, basketball. Then therefore we organized events we invited professional psychologists for mental health. Then lastly, we bought a sewing machine to sew any kind of product. So for 6 months during our project, we reached out to above 400 people. So we highly sure that this estimation will increase in the future.
And the biggest challenges we have faced during the project, firstly, it was the lack of professional advisors because we organized a variety of events. And when we do the event, we needed a professional advisor to tell us what was going well and what was going bad. And then the last challenge we have faced is that less engagement of young people. Because of the pandemic, many young people prepared to stay inside. So it was a little bit difficult to encourage young people to come out and come to our events. But as the time went on, it was better. And the biggest achievement was eco bag creation events that we organized in 2022. And it was really good event to encourage young people because they could paint and they could decorate the eco bags. And the result of our project has been continuing to reach more and more young people in the community. And we think it's important to continue to address the issue because it's a great opportunity to encourage young people in your community and make a big impact with the support of global youth mobilization. And last but not least, you can learn together during the project. So thank you everyone for being with us until here. And if you would like to join us, please search YMCA Mongolia on Facebook and YMCA Youth Center on Instagram. Thank you everyone.
Thank you very much.
And thank you everyone for giving us this chance to present our project. And my question for the speaker is that, how much does physical health affect mental health? Is it one of the areas that World Health Organizations are actively addressing in recent years?
Yeah, thanks so much for the question, Nene. It's really interesting to be in the hot seat on the Global Youth Mobilization virtual celebration. Again, I don't have all of the answers, and so I think it's really nice for us to connect and think out loud and really share the space. I do want to kick off by saying that, just listening first to Nigeria, shifting to Cameroon, and then Mongolia. Wow, what an interesting and diverse mix of projects, but then also thinking about the commonalities of the projects, right? And Lomin team are working on healthcare professionals and mental health. And here's a team in Mongolia working on children and adolescent health. And I think everyone's filling a gap, but it would be really interesting to compare notes and also see if there's areas for collaboration as well. Thinking about the project in Nigeria, Michael and team, is there also room to think about how to engage more young people in the work that you're doing? So those common threads, I think, is really interesting, and it's something that I hope will take off organically as well. Jumping to the questions ahead, but before I did, I wanted to talk about the importance of creative spaces and exciting spaces for young people. And I was up in Rwanda recently at a menstrual health site. And if I can use the word, well, I can use the word because this is a youth celebration, really. And it was the coolest space I had ever seen for young women and girls who are menstruating to go there to feel safe. And I even joked and said, I wish that when I was menstruating, I'm able to access such a space. And so this project makes me think of the site specifically. And the reason I say that is we shouldn't underestimate the physical and the virtual space. Yes, we all do operate largely, Generation Z and millennials do operate in a virtual space, but I think that the physical space still holds merit. The creative space, the color, the ability to engage young people in different activities in person also holds enormous weight. And that then takes me into my thoughts around the link between physical health and mental health. And they obviously are tied in and go in or tied in very closely. I mean, even when we think of the definition of health, it's the well-being of physical, mental health, etc. So that alone takes recognition of that linkage. thinking through when one is either going through a tough time, the impact of exercise and reducing stress levels, etc., is also great. But then also good physical health and what that means for mental health. So it's quite an interesting, question. But I think as you unpack it again, I think the link is absolutely strong. I think linked to work related around adolescents, youth, and health as well. We need to think not just around physical health as in sports, etc., but then also the environmental health that we have. So, what's the safe spaces in one's household, for example? Is it a space of violence, or is it a safe space? What's the access to amenities for a young person, like electricity, water, toilets, as we heard? So I think physical activity is closely linked to other areas of health as well. One big thing which is emerging in recent years is urbanization. And we also, for example, seeing high levels of unhealthy foods, unhealthy drinks, and that's also linked to the lack of physical activity, which then leads to mental health issues. So I think all of this is intertwined. It's really exciting to see. My thoughts is this is one of the first projects I'm actually seeing where there's such a strong link between physical health and mental health. And as a yogi myself, it makes me think about, during the pandemic, I've never been a very physically active person, but during the pandemic, I'd taken up yoga, and I also had lost my father during that period. But yoga, for example, had helped me to become more aware, more conscious, have a better state of mental well-being, and it transformed me as a person. So I don't know if it's okay to share just, a personal example of the interlinkage between that physical health, that mental health, and that enormous value it has for young people, including thinking about those physical spaces. So just a massive congratulations as I listen into all of these really diverse but utterly impactful projects that GYM has supported.
Thank you, Shakira. That was really insightful. Today, we saw before us an incredible showcase of some of the most innovative and impactful projects supported by GYM from around the world. I'd like to share our thanks to these projects teams for sharing their passions and work with us today, and to congratulate all of GYM's project teams that have delivered youth-led solutions for mental and physical health. Thank you also to Shakira for being part of this event and for bringing your knowledge, expertise, and advice for all of us to benefit from. All of the events from today will be available to rewatch afterwards, and please do check out our youth-led solution showcases for our other 3 thematic areas too. Don't forget to share your thoughts on our comments on Twitter, Facebook, or Instagram with us. And before we close, a huge thank you to all of you for joining us today. If you are a young person leading change, we hope you are inspired and encouraged to continue the important work you do in your communities. And if you're an ally, we deeply value your support and hope you are left even more determined to invest in the potential of young people. We are, indeed, unstoppable together.